Well, the recent mumps outbreak here in Hawaii has grown to be worse in several decades. It now stands at 770 with 610 here on Oahu, 108 on Hawaii Island, 49 on Kauai, and 3 on Maui. The health department says adults and adolescents make up the majority of those cases. Officials believe the common factor for exposure has been some type of gathering, whether it's school, work, or church. Now, this ongoing outbreak began last March as 2 clusters of cases involving 9 individuals on Oahu. Now, Adventist Health Castle is here today to break down this more by providing some tips and information on mumps. Audrey Torres, Education and Training Manager at Adventist Health Castle, joins us with more. Good morning.
Good morning.
Thank you so much for being here today.
Thank you for having me.
Okay, so could you break it down for us? What exactly is mumps and why are we talking about it today?
Well, mumps is a contagious disease, and it's caused by a virus, and it's passed by infected individuals within close contact, which is why we are concerned about the gathering areas and people who work in close clusters. So yes, we are having an outbreak now in Hawaii, as you mentioned the numbers. So there is concern, and that's why we're here talking about it today.
Okay, and how would someone know that they have it? What are the symptoms and how can it be treated?
Well, treatment is really focused around prevention with the vaccination. So we have a MMR vaccination called measles, mumps, and rubella. That is the #1 way. It's really preventing the measles. Now, if you have symptoms, and the symptoms are really focused around, there's some swelling in the jaw area in the back by the parotid gland. And so what you'll see is a swelling and a little bit of rash in that area. The person would have a headache, a sore throat, a cough, loss of appetite, really fatigued and tired, and muscle aches and weakness. So these are some viral type of symptoms. So we really want to be able to focus and determine the parotid gland swelling is really a characteristic of the mumps.
Oh, wow. Okay, good to know. And how do people get infected then? You were saying it's from other people, and how can you kind of prevent getting infected?
Well, that's a great question. People who are coughing or sneezing will end up dispersing respiratory droplets into the air, and we then end up breathing it in, and if the person is infected, that's how we will then contract mumps. Now, people who also share cups, forks, knives, anything that you can share saliva will pass the mumps virus on as well. So we really want to take courtesy when you're coughing or sneezing to cover your mouth. Don't go to work if you're sick. If you have any of the symptoms, follow up with your healthcare provider. And if you need a healthcare provider, please check our website at adventisthealthcastle.org.
Okay, good to know. And if you do go in, what is the process like of getting tested?
Well, your physician or healthcare provider will order some lab work to determine if you do have or have come in contact with the mumps virus. And then they can determine what's the right treatment for you. Right now, we don't have any good antiviral medication for the mumps, so the treatment is really focused around the symptoms. So alleviating the symptoms through nonsteroidal anti-inflammatory medications to help with the swelling, analgesics to help with the fever, and lots of rest and hydration. Your body needs to be able to fight this virus, and it's only going to be able to do that by resting and just getting good good food, soft food, so that you can still have nutrition, but also have lots of liquids.
Okay, good to know. And so then if someone thinks they should have mumps, then definitely go into their doctor right away.
They should definitely go in right away, because one of the issues that we're having is we don't want to spread the mumps.
Right.
With all the cases in Hawaii, we need to have a higher vigilance and really monitor what's going on. And if you're sick, stay home. If people are around you that are sick, encourage them to go in. If you have any of the characteristic symptoms, please get followed up with your physician.
Okay, good to know. Thank you so much for all of the great tips. And again, if you're sick, stay home, because that's how it spreads, being in close contact with others. So keep everyone at home and at your work safe as well.
And wash your hands.
And wash your hands. All right, thank you so much for joining us this morning.